What's it called? The last time I saw you, I swear I was just like, yeah, I was gonna go to jiu-jitsu like a normal day. And all
Yeah.
of a sudden, it just like can't go back to the city. I had
Hmm.
no idea that I was never gonna like see you for a while.
I know, it's crazy.
And now you have like super long hair. Like I knew you
Yeah.
had long hair, but now it's like even longer.
Yeah.
How long was it before?
I think it's probably grown like a good 4 inches, maybe.
Oh snap!
Yeah, it was probably like to here.
You haven't cut it at all, trimmed it or anything.
No, we need to trim it. It's like getting tangled, and I'm not used to long hair, so I'm still learning every day.
Yeah.
Yeah.
Dang. I guess we wanted to hear your take on the whole situation of what's going on.
Yeah.
COVID.
Oh, yeah. Because Nate said you work in COVID areas.
Yeah, so I work with the city for the Department of Public Health. And so at the beginning of this, we were called up as like disaster service workers. So it's part of our contract for natural disaster. Essentially, we're planned for natural disasters, earthquakes, floods, tornadoes, stuff like that. And it's supposed to be like just a 2-week period to send out city employees to provide support different areas in the city, programs, services, housing. But this is a first because it's a pandemic. So what should have been like a 2-week deployment is now going 6, 7 months.
Yeah, dang.
And so in April I was deployed, and you can't say no. Essentially, you can. So say if like I had medical issues, medical concerns, and I'm a at-risk person, then I could fill out some form, have a doctor's note, be like, hey, I can't be deployed to any sites where I could be increased exposure. And so they'll give me so much time, but essentially I have to use my own sick and vacation time. So it's not like the city's going to give me money to like sit out. But then they also have the option where it's like, hey, I want to deploy and help, but I can't be exposed. So then they'll try to send me somewhere where I can work remotely, like essentially from home, do stuff with the computer, making phone calls. So we have people in the city that do that, and they're using that for like tracking, to track up the numbers, cases. They also have those people working to help get individuals into shelters, temporary shelters. So I was pulled to a isolation and quarantine site. So it's a hotel that the city's kind of renting out. And so where the rooms are made available to, essentially it's mostly low-income individuals, low-income households. So it's families, that live maybe 10 people to a household, only have 1-bedroom or 2-bedroom apartment, but there's 10 people. And say like one of them gets COVID, they're positive. So, they find out by getting tested at these sites made available to them for free. And then they'll say, are you able to self-isolate at home safely without exposing yourself to anybody else? And they say, no, I live in a 1-bedroom with 10 people. They'll be like, okay, so we'll send you to these hotels. So it's essentially, we have 24/7 nursing staff, behavioral health clinicians, which that's what I am, to provide emotional support. Because, people are freaked out. They get COVID
definitely.
and they don't know what that means. Think it's like the end of the world. So they get there, the nurses in full gear, take them up to their assigned room. And essentially the stays for like average about 14 days. And that just changes based on new information. Also contact tracing when the person's exposed to COVID or gets it, when they're tested. So it's based off of that date. And essentially we get individuals who have like no symptoms. So they need to stay there for like 7 days, being monitored daily to see if they get any symptoms. And after a certain amount of time, the doctor on call will like clear them so they can return back home because they didn't develop symptoms. And then in that time, if they feel the need, they'll test them to see if they're positive or negative. If they're negative, but they were exposed to somebody, they'll just hold them for a certain amount of days to see if they do develop symptoms.
Oh, I see.
And so the main thing of the main purpose of these hotels is to reduce the spread and help the individuals who can't self-isolate to prevent spreading it further. So we get families, kids, moms, dads, and a lot of minorities, got like monolingual Spanish speaking, Tagalog, uh, Cantonese, and then based on staffing, we do try to get individuals who are bilingual. So I'm bilingual, I speak Spanish, so it's great because we get a lot of Latinos in this particular hotel, so they feel a little better when they can actually communicate their needs and concerns, and so I'm there to support them, make sure that they maintain the whole stay, and while they're at the hotel, following all the rules and safety precautions for themselves and for others. So yeah, but it is stressful because it's like when I was deployed, it's like I was like I'm gonna be in front of like being exposed, like because
And
it's
then
at the
you have to
beginning.
go home after.
Yeah,
Right?
and then my wife, has asthma and she has poor lungs, so it's like last thing I want to do is pass it on to her.
Yeah.
So my first month, I was just super stressed. I was literally taking like 2 to 3 showers a day.
Yeah.
And my schedule at this site was like off from a regular 9 to 5. So I started I got off my shift on Friday. I got a call at 5 and said, "Hey, we need you to be deployed at this hotel." I'm like, "Cool, when?" They're all, "This Sunday." I'm like, "Okay, and you're working 2 to 10:30." And I was like, "Okay." And so I had one day off, and then a whole new location, kind of like thrown into the fire and like learning as we went. And so, because it's a first for everybody. So not knowing what services we needed, what supplies we needed, like it was just constantly like order this, like stuff kept coming up while we're trying to provide support to all these individuals. So they're freaked out, and then we don't want them to see us freaking out about trying to be prepared for them.
Yeah.
And it's just like advocating for them, like we need these things because these are the type of people we're going to get. We're going to have kids, so we need kids supplies, kids clothes,
Entertainment for the kids.
yeah. It's like it's essentially they're being sent to a hotel room and they're not allowed to leave.
Yeah.
Yeah.
But they have the shower, the bed, constant contact with anybody if they need support. If they have family or friends that are negative in the community, they're allowed to like drop items off for them, clothing, food. It's just trying to make them feel like as normal as possible and not feel like they're like a disease.
Do they have to stay in their rooms, or do they chat with other people in the other rooms? Kind of thing?
No, so they stay in the rooms. Unless they're families, then we kind of connect them in rooms together. But we don't, essentially, they do end up sharing if they're families from the same household.
Yeah.
And we make sure that they're all cleared before they're all allowed to leave.
Oh, I see.
Yeah, and then we just ask them if you want fresh air, you just got to step outside your front door, keep your mask on, make sure nobody else is on the balcony, and kind of like take turns that way, like.
That
and
must
then
be
only
really stressful.
Yeah.
Just being in a room.
Sounds
for so
stressful.
long.
and then only the nurses are allowed to go up into the room with protective gear, and even when they go up there, they would check them just at the doorway, like not cross the threshold, take their vitals, see how they're doing. They check their symptoms, and then we, the behavioral health social workers, we follow up. Do they have any appointments that they were planning on going to that they need to reschedule? If they have any medical needs, medication needs, if they, we ask them if they are using any substances, because again, that would be a reason why somebody would leave against medical advice. If they're an alcoholic, we don't serve alcohol, so we gotta help them stay there. And I know it's in the news where people are upset that like the city's providing like drugs, needles, and alcohol, and it was kind of like exaggerated in the public. But it's like, imagine you're addicted to something and you're being isolated for a bigger reason, and then in order for us to help you stay there and be safe to yourself and for everybody else, we gotta give you not an incentive but just something to help you pass the time or stay there at the hotel.
Just taking away the reasons for leaving, basically.
But it's not like a free-for-all, like we're going to give you everything you asked for. No, that's not at all,
Slumber.
And then, there are people that don't have any issues, no concerns, no needs, but they're just like, oh, F this, like, I don't want to stay here, and we do our best to talk them into like staying and be like, no, you're gonna expose your friends, your family, and we still get people that are like they don't care. But I think that was like the first month, which was really hectic. But now it's like a lot better.
Yeah.
People are more understanding. We don't have any issues really of people trying to get out of the hotel rooms and leave without us knowing. We just open the communication for them, and we're there to support them.
Are you fully like covered? Like, what do you wear when you go to see them, type of thing?
Yeah. So I was deployed in April for a month, and then I went back to my clinic, and then now it's deployed again. So I'm deployed till the end of this month.
Oh, I see.
So luckily at these sites, it's only the nurses that do the face-to-face interactions, and they have like scrubs, like gowns, disposable gowns, face shields, masks, gloves, But us, we're in the front desk, so our contact is just via phone. So we call up to the room, check in with them, and they call down to us. So essentially, I'm really safe compared to my clinic. Every once in a while, I do have face-to-face interactions with them, but it's outdoors. It's like outside the lobby. So there's fresh air, it's open space, and I usually do that when I need to assist with translation for the nurses. Or sometimes, if somebody's trying to leave the hotel, security will stop them, and then I go out there and try to like just talk to them. Just figure out why they're leaving, what do they need. Again, just making sure they don't leave the premises and potentially expose others.
You feel like you have to wash your clothes all the time?
Not as much now. I think what helped is working on site with nurses. So like the first month, I was just picking their brains, like, how diligently do I have to wash my clothes? I have to like take everything off, not touch this, not touch that. And essentially the only ones that really have to do all that are the first responders that are within like 2 feet in contact with somebody, medics, doctors, nurses. They're the ones that have to be super protective and diligent about, taking off their clothes before they enter the house, doing all those steps to prevent the spread. But with myself, since I'm not that exposed, I'm in a safe bubble, I still maintain all the basic practices, wearing a mask all the time, washing our hands, sanitizer, maintaining social distance. So it's a little, it's not as stressful anymore.
Yeah, I feel like it was more just the unknown when it first came out. So you were just, being overly cautious like I think a lot of people were. And now it's kind of, seems like people have a better grasp and are less afraid, maybe.
No, totally. It's just more information's come out, So it's like, essentially as long as you're not breathing the same air, if... now we have the space to like go outside and interact with people while wearing a mask, and I think it just gets weird because it's like wearing masks. It's not saying you're positive or like stay away from me, but it's just like we all accidentally spit while we talk.
Yeah.
I know I've had so many conversations with friends where we're laughing and then like I see the spit come and smack and I'm like I don't say anything. It's just like it happens.
Or the first time you sneeze in your mask and you're just like, wow, it's really wet. Like
you sneezed in your mask?
By mistake. like you're not used to having it. Yeah.
And it's weird. You're not going to take something off to cover like sneezing terrible or a cough when you already have that. But it is weird. It's like ew.
I have to admit, I went to spit and I forgot I had my mask on.
Your mask on?
Oh no! Why did I do that?
I did that too.
Because when I wash my hands, I do a little spit and I forgot I had my mask on. Yeah.